Welcome to Fempower Health. Georgie here. I hope that everyone had a wonderful summer, and we are so excited to report that new episodes are back. So check out this preview. Now, many times on the Fempower Health Podcast, we talk about the limited funding and research in women's health. And sadly, many women do experience a bit of medical gaslighting. But sometimes it's the foundations and simple yet obvious things we miss, but are so important.
To me, it's actually exciting purely to understand the basic biology of the uterus and menstruation and the ovaries and the clitoris, like the basic mapping. I'm excited for us to have that.
So the average person will use nearly 14,000 disposable products in their lifetime, and the amount that you can save by reusing a menstrual cup for up to a year or more is just incredible.
Wow.
And then you can imagine the cost savings from that. So the average person is spending thousands and thousands of dollars over their lifetime on disposable products. But like I mentioned, there's been a low adoption rate. And from Cindy's research and from our additional beta testing and surveying, we found that the insertion and intimidation of insertion was the number one barrier to trying a menstrual cup, despite other benefits.
But education, data, and awareness are key.
Everyone wants a magic bullet, but the magic bullet so far, and we just keep getting this message over and over and over again through lots of studies around aging in humans, is that what you put into your body and how you use your body are probably the most impactful things that you can pay attention to.
The whole goal of what we're doing and by tracking the cycle and bringing that body awareness and figuring out maybe patterns of symptoms isn't to say, hey, this is a bad day for you, just like take a day off or do rest, or maybe you shouldn't like do high intensity today. And it's more like, no, you're gonna have these symptoms on this day, you might feel worse. So what can we do proactively leading up to that so that those symptoms aren't gonna affect how you play, because you're gonna play.
People have these fears like, what if I'm a pedophile? What if I want to hurt my family? What if I want to kill myself? What if I want to do, and if you don't realize that that's OCD, you think that you're just a terrible person. You think something is profoundly wrong with you. And there's so much shame, so much shame. And just realizing that there are other people who are suffering with those same types of thoughts, there's such relief in that. It doesn't make them go away, but at least it's OCD and it isn't like this unique defect or sign that you're a monster.
We've come a long way, but there is still more to learn.
So 1930s to now fast forward almost 100 years later, not much had changed. And now, of course, we're seeing a ton of innovation in this space, a lot of younger startups kind of popping up, Sunny being one of them.
And so if we can understand the mechanisms that underlie aging, what's causing it, what's driving it, then we can use that knowledge, we can exploit it to target all of those age-related diseases at the same time.
And a big thank you to these experts. With more and more women and curious minds entering healthcare, we will continue to have improvements in our knowledge and the care we receive. Now be sure to subscribe where you listen to podcasts. And if you like the content on Fempower Health, please be sure to write a review. The feedback is incredibly helpful and appreciated. And be sure to check out the new website, fempower-health.com. And I can't wait to share these new episodes starting next week.